Dr. Scott Kilberg, the Video Foot Doc, here with another video for you on all things foot and ankle. Today I'm going to continue on my discussion that I started with my last video regarding the causes of toenail pain. Last time I covered ingrown toenails as well as toenail bruising. This time I'm going to cover something a little bit different, in that I'm going to talk about conditions that can cause the toenail to become thickened and to change their shape and therefore become painful. Now, the first condition that can cause toenails to change shape is toenail fungus infection. Now, toenail fungus is extremely common. Millions and millions of people all over the world have it, and you can get it at any age. It's not a particularly serious infection, and it doesn't tend to creep up the skin towards the legs or anything like that. But what it does do is it sort of sits in the skin surface underneath the toenail, and it's very difficult to treat because of that location, because the toenail plate itself actually offers some form of protection from the usual simple antifungal medication, which eradicates that type of fungus in any other situation, such as athlete's foot. It's the same thing that causes athlete's foot in general. So this toenail fungus infection is relatively difficult to treat, and one of the things that it does to the toenail is it can gradually cause damage to the toenail material itself. In much more advanced cases of toenail fungus infection, instead of just simply seeing discoloration to the toenail, you'll also see a significant amount of loosening. The nail can become very crumbly. Part of it can actually be torn off or lifted off easily. But it's primarily the significant thickening and debris that forms underneath the toenail that's usually the source of pain for most people. Now, the toenail infection can involve any of the toenails, all 5 toes on each foot. Sometimes it just involves one toenail, and sometimes it can just involve a couple where it actually skips over from one toenail to the other. We're not really certain why that occurs, but it's clinically seen every single day by people who treat this condition. Toenail fungus infections are notoriously difficult to get rid of because there aren't a lot of medications that can eradicate it. Oral medications have been in use for quite some time and are generally effective, but occasionally can have some potential increased risk for liver disease and other types of complications. Topical medications are far less effective, meaning medications that you can put on top of the toenail to try to get rid of the fungus. They're far less effective than taking an oral agent, but they're also far safer because they have no general side effects or other complicating issues other than just having to use it for a very long period of time. Now, treating the toenail fungus can often lead to a normal toenail once that nail fungus is eradicated, because as the new nail grows in without being destroyed by the fungus, it can return to a relatively normal shape. However, if enough damage has occurred over time, such as if you've had toenail fungus for many, many years, sometimes the nail root cells that grow the nail out can become permanently damaged as a result of that infection, and so the toenail, even if fungus is removed from it, will still be very thick and potentially painful as far as pressure inside the shoes is concerned. Now, this brings me to the other main cause of why one can have toenail pain, which is basically simple thickening of the toenail itself. Not all thick toenails are necessarily toenail fungus infection. That's often a common misperception. Anything that creates toenail damage or damage to the nail root cells that grow the toenail out can create an excessively thick toenail. Now, some of these conditions can include injuries, such as things dropping on your toe, or you simply kick something, and that can immediately cause toenail damage. Other things are much more subtle, such as the use of a really tight shoe over a long period of time can gradually create damage and injury to the nail root cells itself and cause the nail to begin to grow in an abnormal shape because of that damage. Now, the abnormal shape can be very, very thick. The nail can also grow out at an angle, where instead of growing straight out, it grows out curved to one side or the other, or the toenail can even become ingrown, as I discussed in the previous video. Now, the unfortunate part of this type of damage and this main cause of pain, in which you have excessive thickness to the nail or misshape to the nail that causes pressure in shoes, the unfortunate part about that is that that's permanent. Once the nail root cells are damaged, you can't reverse it. You can't make them grow nail as they normally did before. So options for people who have particularly thick and painful toenails as a result of not infection or any other issue, but simply because the nail root cells have changed the way the nail grow, will include either techniques to kind of grind down or debulk the nail to make it more comfortable in shoes, or The other more simpler option is just to simply have the toenail removed permanently. The toenail doesn't serve any essential function. The skin that's underneath the toenail is just normal skin. And once you have the toenail removed, and it heals from that in about 2 to 3 weeks for most people, there's no pain, no discomfort, and it's very easy to live with. And for you ladies out there, from a cosmetic perspective, you can actually even paint the skin surface that the nail used to sit on, and it relatively looks like a, a relatively normal nail if you were to just take a quick glance at it. Now, if a lot of nails are involved that are thick like that and painful, that may not necessarily be the best option, because removal of all the toenails can take some time to do. Typically, we try to split several of those apart, where we don't remove every single toenail all in one sitting. Makes for a relatively difficult recovery, and if it's maybe a couple at a time, that's a little bit easier. So for some people, though, with very painful toenails, that's an option. It's a little bit easier to digest if it's just sort of one solitary nail for most people, however. Well, I hope you enjoyed this video. Please look for more videos on all things foot and ankle on this site as well as others, or you may check out my website at www.inpodiatrygroup.com. Thank you.